Good day, everyone, especially to our doctors and nurses. The lecture for today is about the cumulative antimicrobial susceptibility of clinical isolates, or the Antibiogram for the year 2021. Although this topic is not part of our academic calendar, but I believe this one is very important that every doctor should know. According to the World Health Organization, antimicrobial resistance has emerged as a major public health problem all over the world. Infections caused by resistant microbes fail to respond to treatment, resulting to prolonged illness and greater risks of death. As per MOH, or the Ministry of Health, antimicrobial susceptibility testing is done to determine the effective antibiotics to combat infections. This information may be used by medical practitioners, laboratory microbiologists, and health professionals as a reference guide. In addition, according to the Center for Disease Control and Prevention, inappropriate prescribing of antibiotics and lack of infection control action can contribute to drug resistance in healthcare settings. Hospital antibiogram are commonly used to help guide empiric antimicrobial treatment and are an important component for detecting and monitoring trends in antimicrobial resistance. Antibiogram data are often used by clinicians to assess local susceptibility rates as an aid in selecting empiric antibiotic therapy and in monitoring resistant trends over time within an institution. The cumulative antimicrobial susceptibility in Al Jazeera Hospital is reported annually. Specimen of different types sent to the hospital laboratory for cultures and sensitivity are tracked for positive results of clinical isolates. Furthermore, patterns of antimicrobial resistance are also monitored. Hospital antibiogram are reported and tracked per department, as well as per specimen and a cumulative report for all clinical isolates. The Infection Prevention and Control Department, through its daily rounds, collect medical record numbers of patients due for culture and sensitivity. These are the total number of clinical isolates for the year 2021. Okay, it is divided into gram-negative microorganisms and gram-positive microorganisms. So, as you can see on the second column, we have the name of microorganisms and the number of isolates. So, among all the microorganisms, Staphylococcus aureus has been isolated with a total number of 175. Here you can see the percentage of clinical isolates grouped to gram-negative and positive microorganisms. So out of 100%, 57% are gram-positive, total of 349, while 43% or 258 are gram-negative organisms. Most of the clinical isolates were found in the outpatient department, meaning to say these are patients who came to the hospital for consultation and was ordered for culture and sensitivity. Of all the gram-negative microorganisms per clinical isolates, E. coli has the highest number, which is around 142. While for gram-positive microorganisms per clinical isolate, as what I have mentioned, it's Staphylococcus aureus with 175, followed by beta hemolytic streptococci with 97 and enterococcal species with 75. Now, as you can see on the slide, this is the distribution of gram-positive isolates in outpatient departments, since most of our isolates are found in outpatient. So we have number one is we have your Staphylococcus with 50%. Next is we have your beta hemolytic streptococci with 28%, followed by our enterococcal species with 21. Next is we have Streptococcus pneumoniae with 1%. The other one is the distribution of gram-negative isolates in outpatient department. So we have E. coli with 56%, followed by your Klebsiella species with 26%. Next is we have your Acinetobacter species with 10%. Now next is we have distribution of gram-negative isolates in inpatient general wards. So we have only few numbers of isolates found in general wards. We have E. coli, which is 4 or 80%, then Pseudomonas species with 1 or 20%. So total of 5 only microorganisms or clinical isolates was found in patients. While on the while for gram-positive isolates in inpatient general wards, we have Staphylococcus with 4 and Enterococcal species with 1. Next is we have the distribution of clinical isolates in general intensive care unit. So we have the GICU. These are patients admitted in the GICU. We have it's a tie between Staphylococcus aureus and E. coli with 33% each, followed by Streptococcus pneumoniae and Acinetobacter species. There are only 2 clinical isolates detected or found in the coronary care unit. So now this is the distribution of clinical isolates per specimen. So we have number 1, most of our clinical isolates are found on urine with 57% or 347 in total, followed by HVS swab or our high vaginal specimen swab, which is 36% or 219 total. Next is we have from sputum with 3% or 16. And we also have for throat swab, which is 4, urethral with 3, specimen with 7, and blood with 6. Now let us see what are the clinical isolates found in urine specimen. So number 1 is we have your E. coli, which is 39%, followed by our Staphylococcus aureus with 21%. Next is we have your Klebsiella species with 17%. Next, we have your Acinetobacter species and beta hemolytic streptococci with 8%, followed by Enterococcal species with 5%, and lastly is we have your Pseudomonas species with 2%. Now, for clinical isolates in semen specimen, most of the clinical isolates found on semen is we have your Staphylococcus aureus with 4, followed by E. coli and your Enterococcal species with 1. For clinical isolates in urethral swab specimen, we have only Staphylococcus with 2. Now, for your HVS swab specimen, number 1 is we have your Staphylococcus aureus with 36% or a total of 81 clinical isolates. Next is we have your beta hemolytic streptococci with 36% or total of 79 clinical isolates. And we also have on the third one, we have your Enterococcal species with 26% or a total of 57 clinical isolates. Then lastly is we have your Klebsiella species and your Streptococcus pneumoniae with 1% each. Now let's go to your sputum specimen. So most of the clinical isolates found in sputum is we have your Klebsiella species, which is 59% or a total of 7. Then followed by Staphylococcus aureus with 25% or 3 clinical isolates. Then lastly is we have your Streptococcus pneumoniae and your Pseudomonas species. For our throat specimen, so we only have 4, and out of 4, there's 3 Staphylococcus aureus and 1 Klebsiella species. How about for the blood? The highest number of clinical isolates for our blood specimen is we have actually it's a tie. They all have 2 each. We have your Klebsiella, E. coli, and your Staphylococcus aureus. Now this, as you can see on the screen, this is your cumulative percentage for antimicrobial susceptibility for clinical isolates. This is for the year 2019 to 2021. Now, as part of the protocol in making antibiogram, you cannot record clinical isolates that is less than 30. Okay, that's why we included the last 2 years of our clinical antibiogram so that we can acquire a higher number of clinical isolates. On the first column, you can see it is divided into gram-negative and gram-positive microorganisms. On the second column, those are the name of your isolates, which is categorized into gram-negative and positive. On the third column is we have your total number of your isolates. Then on the succeeding columns, it is also categorized. The first upper row or row is we have your antimicrobial classes. We have aminoglycosides, cephalosporin, beta-lactams, fluoroquinolones, penicillin, lincosamides, sulfonamides, nitrofurans, glycopeptides, and your tazobactam. Now, I did not include already those antibiotic that has less than 50% susceptibility to a certain isolate or microorganisms. This report is for those antibiotics with greater than or equal to 50% susceptibility to isolates that are found on the second column. So for the first species or first isolate is we have your Acinetobacter species with a total of 132 isolates. That's from 2019 to 2021. So this microorganism is susceptible to amikacin, gentamicin, tobramycin. We have your empinem, cefepime, your ceftriaxone, aztronam, nitrofurantoin, and your tazocin. Next is we have your Klebsiella species with a total number of isolates of 230, and it is susceptible to the following antibiotics. We have your amikacin, gentamicin, empinem, cefaclor, aztronam, levofloxacin, nitrofurantoin, and your tazocin. The third one is we have your Neisseria gonorrhea with a total of 57, which is susceptible to empinem, cefepime, cefotaxime, cefuroxime, levofloxacin, augmentin, and nitrofurantoin, and your tazocin. The fourth one is we have your E. coli with a total number of isolates of 351 that is susceptible to amikacin, gentamicin, tobramycin, empinem, cefepime, cefuroxone, aztronam, nitrofurantoin, vancomycin, and your tazocin. The fifth one is we have your Pseudomonas species with a total number of 144 that is susceptible to amikacin, gentamicin, empinem, cefaclor, cefoxitin, ciprofloxacin, and we have your tazocin. The fifth one is we have your Pseudomonas species with a total number of 144 that is susceptible to amikacin, gentamicin, empinem, cefaclor, cefoxitin, ciprofloxacin, and we have your tazocin. The last one on your gram-negative organisms is we have your Proteus species with a total number of 44 clinical isolates. This is cumulative already from 2019 to 2021, but still the number is very low. So it is susceptible to amikacin, gentamicin, ciprofloxacin, and we have your vancomycin. Now let's go to your gram-positive organisms. Let's start with your Streptococcus pneumoniae with a total of 69 number of clinical isolate that is susceptible to ceftriaxone, ampicillin, clindamycin, and vancomycin. Second one is your beta hemolytic streptococci with a total number of 308 that is susceptible to your empinem, cefepime, cefuroxime, levofloxacin, amoxicillin, augmentin, clindamycin, nitrofurantoin, vancomycin, and your tazocin. The second to the last for our gram-positive organism is we have your enterococcal species with a total number of 171 clinical isolate that is susceptible to levofloxacin, augmentin, nitrofurantoin, vancomycin, and last is we have your tazocin. The second to the last for our gram-positive organism is we have your enterococcal species with a total number of 171 clinical isolate that is susceptible to levofloxacin, augmentin, nitrofurantoin, vancomycin, and last is we have your tazocin. Last for our gram-positive organism is we have your Staphylococcus aureus with a total number of 461 that is susceptible to amikacin, gentamicin, empinem, cefoxitin, cefuroxime, augmentin, oxacillin, clindamycin, cotrimoxazole, nitrofurantoin, vancomycin, and we have your tazocin. So this antibiogram will serve as your guide in which antibiotic you are going to prescribe to your patient who are tested with the following isolates. I will be distributing a copy of the latest antibiogram report in every clinic and in every station so that our doctors and our nurses will be guided on the proper use of antibiotics to certain clinical isolates. Thank you so much for your time. I hope that you are going, especially for our doctors, that they will really utilize our hospital antibiogram in prescribing antibiotics to their patients. Thank you, and we will have another topic again next week as part of our clinical academic calendar, which is for personal protective equipment or our PPE in the healthcare setting. Thank you, and God bless.